Bismillahirrahmanirrahim. Assalamu alaikum. Today is the last episode of communication skills. This is very important. And if we say that this is the climax of communication skills, it will not be wrong. This is about the breaking bad news. First, I will discuss the breaking bad news in a medical setting, in doctors patients communications, and then I will apply this module to the non-medical scenarios as well. So first, we shall discuss breaking bad news in a medical scenario, and after that, we will apply this module to other non-medical scenarios as well. So in the breaking bad news, the first question which comes in mind is, what is bad news? Any news that adversely and seriously affects an individual's view about her future is called bad news. I repeat, any news that adversely and seriously affects an individual's view about her future. In medical setup, this will be health-wise. And in non-medical setup, it will be regarding business, family relationships, or other ones. In medical setup, breaking bad news is not only done in the context of cancer. Breaking bad news is not only done in the context of cancer. In other lifelong diseases, it may be required. The badness of the news may depend on the patient's circumstances. For example, patient who is a driver by profession and he develops epilepsy, so driving becomes prohibited for him. So he will lose the profession. And this will be a bad news for him. Epilepsy is a non-cancerous condition. That it's a bad news for that very patient. In breaking bad news, we need to consider how the news will impact on the patient's and her life. This is very important. Next question is, why is delivering bad news difficult? Why is delivering bad news difficult? Breaking bad news is a stressful experience for clinicians. It requires advanced communication skills and training. And the common fears regarding breaking bad news are, how will the patient react? This is the common fear in the mind of the doctor. How will the patient react? What if I don't know all of the answers, which the patient will ask is a result of breaking bad news? And what if they blame me that all this has happened because of the doctors? So these are the common fears in the mind of the doctor or healthcare professional who breaks bad news to any patient. Key to success. What is the key to success in breaking bad news is that breaking bad news is a difficult task, we know. It requires sensitivity, empathy, and effective communication skills. Here are some tips to help you break bad news with compassion and care. What are these? First, choose the right time and place. Choose the right time and place. Find a private and quiet setting where the person can process their emotions without distractions. Second tip is be honest and clear. Use simple language to convey the news, avoiding medical terminology. Third tip is show empathy and compassion. Show empathy and compassion. Validate their feelings and concerns, offering support and understanding. Show understanding and compassion through verbal and non-verbal cues. The fourth tip is listen actively. Listen to the patient actively. Allow them to express their emotions and concerns, listening attentively to their response. Pay attention to the person's response both verbally and non-verbally. Fifth tip is provide support and resources. Offer guidance on next steps, follow-up care, and available resources. The sixth tip is be prepared for a range of reactions. Anticipate shock, denial, anger, sadness, or acceptance, and respond with empathy and understanding. This is very important that you should be prepared for a range of reactions. You should anticipate shock of the patient. Patient may be denying, patient may become angry, may become sad, or may accept the diagnosis. And you must respond with empathy and understanding. The seventh tip is respect their boundaries. Avoid pushing them to talk or share more than they are comfortable with. This is very important. And the eighth tip is follow. Check in with them after the initial conversation to offer ongoing support and care. Remember, breaking bad news is never easy, but approaching the task with compassion, empathy, and effective circumstance communication can help make a difficult conversation a little easier for both parties, you and your patient. Level of the patient. Level of the patient or person is a multifactorial and not a fixed aspect. By level, I mean education level of the patient, his or her level of understanding, his or her level of economical status, the socioeconomic background, even his or her professional background. And of course, age and mental level is one of the factors to be considered. With this background, let's proceed to the spike model. Spike's model of breaking bad news. The spikes model is a widely used framework for breaking bad news in a compassionate and empathetic manner. Developed by Dr. Robert Buckman, the model provides a structured approach to delivering difficult information to patients and their families. Every word of the spikes has its own meanings and in the same order. The S means setting, P means perception, I means invitation, K needs mean the knowledge, and E means emotions and empathy. And the last S means support, strategy, and summary. Let's discuss what each word means. What does each word mean? The first alphabet of the spikes, the S, means setting. By setting, I mean choose a private and quiet setting where the patient feels comfortable and secure. Ensure minimal distractions and adequate time to discuss the news. Either off your phones or put it on silent mode. Ask your attendant not to allow other people to come into the room. And you should be wholly solely involved in the discussion with the patient. This is mean setting, the first alphabet of spikes. The second alphabet of spikes is P, and P means perception. By perception, I mean assess the patient's understanding and perception of their situation. Ask few questions that what's the knowledge of patient about his her disease, and you will start from that point onward. Ask open-ended questions to gauge their awareness and concerns. For example, what have you been told about this so far? Are you worried about this may be a serious? So the perception indirectly prepares a patient to receive a bad news as well. And you start from the point till where, till when this patient has got some knowledge. For example, a patient may come to you with a liver cancer. The patient may have done the ultrasound, and the ultrasound person may have told him that there is some mass or some sorts of uh, swelling in your liver, and now the patient has come to you. So the patient knows that I have come to you, that what is this mass of the liver, what is that swelling, is it serious or it is just a simple one? So you start from this point onward. The third alphabet of the spikes model is I, and I means invitation. By invitation, I mean that you obtain permission from the patient to have the discussion. This is very important. Ask the patient that should we discuss your investigation, your disease further? This is very important. What does the patient want to know? And for the how much knowledge, how much details of the disease the patient wants to know. This provides the opportunity for patients to prepare themselves. And in this phase, use phrases like May I share some information with you? This is very important. So, we have discussed the setting. First step, the setting of the spikes. Second phase, the perception. And third phase, the invitation. Now comes the fourth phase, or the fourth alphabet, that is the K, and K means knowledge. And in this phase, clearly and honestly deliver the news, avoiding jargon and other medical terminology. You should be clear in your words, in your message, in your talking. Provide accurate and concise information using simple language. And deliver the information in small chunks. And check the patient's understanding. And give the patient time to digest the information by giving silence phrases, silence spells. After the knowledge, the next alphabet is E, and E means emotions and empathy. And in this phase, in this step, you recognize and respond to emotions of the patients with empathy and concerns. You acknowledge the shock which the patient has received and don't give false reassurance. You can say, I can see this as a huge shock for you. You can say, I can understand that this was not the news you were expecting. I'm so sorry, but this is fact. And the last phase of the alphabet is S, and S means support, strategy, and summary. And in this last phase, you explain the next step required. You offer support and resources to help the patient cope with the news. And you check the patient's understanding of the news. So the spikes, which is 6-step model of breaking bad news, it encourages healthcare professionals to approach difficult conversations with sensitivity and empathy. By following this framework, clinicians can deliver bad news in a way that respects patients' autonomy and dignity, while also providing support and guidance during a challenging time. As I said, the breaking bad news does not mean that you are talking about the cancerous condition. It may be for other conditions like patient being diagnosed with hypertension, with diabetes, with liver cirrhosis, even patients diagnosed with chronic hepatitis B or C, they get shocked. So you can apply this spikes model to all such scenarios. As I said in the beginning, that spikes model of breaking bad news may be applied in non-medical settings as well. For example, someone has failed in exams and this was an exam required for the career of his or hers, and you want to communicate, so you can follow this model. Somebody has bad news regarding business matters, so one can communicate following this model. Somebody has got some bad news regarding family affairs, death of a relative. or some other bad scenarios. So, this is the 6 step model. And when you follow this model, that first you take care of the setting where you will break the bad news, and the second phase of perception, that you know that how much knowledge the person is having about that bad news, expected news. Invitation, that you ask the permission of the person that I want to share, or should I share the details of the bad news. And the knowledge, okay, the knowledge, you give the essential details, the details to the extent the person requires or wants or allows, in a simple words. And then comes the, after listening to the bad news, there is the reaction of a person. So you sense the emotions and do empathy. And of course, then you suggest the strategies, support, and at the end, you ask the summary what the patient or this person has understood from breaking the bad news to him or her. So when you follow this 6 step process, the breaking bad news becomes easy, and the person comes at par and actually gets involved in solving that bad news or facing that bad news and proceeding ahead. So, dear colleagues, dear friends, in these 5 episodes of communication skills, we, in the first, we discussed what is the communications, what does communication means, and we discussed that there are two, senders and receiver, and the medium may be oral, written, or pictorial. Then, in the second episode, we discussed the effective talking. In the third episode, we discussed the active listening. And then, in the fourth episode, we discussed what is the successful communication, what does it mean, what are the prerequisites for successful communication. And today, we discussed the breaking bad news in medical setting as well as in non-medical setting. I hope I was able to give you the concepts of communication skills in your day-to-day life. If there are any queries, any questions, any comments, please do share with me in the comment sections of these videos, and I will try to answer those either individually, or if that needs another vlogs, I'll answer those queries in that. Thank you for your kind listening. Take care. Khuda Hafiz.